Now, hernia repair depends on what technique we use for the repair of the hernia. So, there are certain principles of hernia repair which we have to keep in mind when we talk of the complication. So, common complications if you are using hernia repair from outside is that sometimes you can have an infection in that area where you have made the repair. Second thing is that now a big thing is that when we use this mesh, which is like a net which is made up of either some non-absorbable suture material or some kind of a substance which actually augments the wall, this mesh, what happens to this mesh in the long period of time? This mesh ideally should be incorporated in the abdominal wall and increase the strength of the abdominal wall. But it also depends in which plane of the layers of the abdominal wall this mesh is placed. So, if it is placed inside, there is a possibility that there may be certain adhesions, meaning the part of the intestine or fat may come and get stuck onto this mesh. Also, if it is placed in between the layers or outside, there might be some dull aching pain because of the presence of the foreign body in this area. Most important that if there is some inadequacy in the repair, there might be a recurrence of the hernia. You may get the hernia again. So, these are the common problems which we face after a repair of hernia, and we have to look into the details. How big was the hernia, what surgical procedure was done, what are the present symptoms of the patient, and how to deal with any of these complications which may be present for the patient.